My name is Edie Hosier. I'm a clinical pharmacist at UC Davis Medical Center in Sacramento, California, and I'm going to discuss the following learning objectives. First, I want to talk about your rights when seeking treatment for an emergency medical condition at the emergency department. Next, I'll talk about how Governor Abbott's recent executive order GA46 might affect you when going to the emergency department. And then I'll talk about what financial assistance options are available to you if you need a prescription medication. So if and when you need to go to the ER for treatment, you are protected by the Emergency Medical Treatment and Labor Act, or EMTALA. This is a federal law that was signed by President Ronald Reagan in 1986, and all hospitals that receive federal funding must follow it. Since the vast majority of hospitals do receive funding from the federal government, EMTALA is the law at essentially any hospital you might go to. So this law means that the hospital you visit must provide you with a medical examination even if you can't pay. They must stabilize your emergency medical condition before sending you home. And if you are admitted to the hospital, they must provide you with the same level of care as all other patients, regardless of your ability to pay. Another advantage of EMTALA is that you cannot be denied treatment for an emergency medical condition, and you cannot be given substandard treatment based on whether or not you have health insurance, your race, color, national origin, sex, religion, disability, or age, and if you are not a U.S. citizen. In August of this year, Governor Abbott issued a new executive order that may be concerning for people who are not currently United States citizens. This executive order requires Texas hospitals to ask if you are a U.S. citizen and if you are in the country lawfully. However, you have a right to withhold this information and not answer the question. Also, EMTALA ensures that however you answer the question, it cannot affect the care that you receive in the hospital. If you do feel that your EMTALA rights are violated at any point while seeking care at a hospital, you can file a complaint by clicking on the link provided in this slide. The next thing I'd like to cover are some options for getting your prescription medications if you are not insured or if you have trouble paying your copays. The first option is that many hospitals and universities in Texas run their own medication assistance programs, and they can help provide you with free medications or copay assistance. A couple examples are listed here, and I encourage you to click on the links and explore more. Texas A&M has a medication assistance program that you can utilize. Note that they require you to present a Social Security card, photo ID, and proof of income. And Texas Tech University Health Sciences Center has a prescription assistance program that they offer through their health clinics. In order to utilize their services, you do need to be an established clinic patient and provide proof of income. The second option is using a drug discount card. The state of Texas has their own discount card called the Texas Drug Card, which is free to all residents of Texas. If you are uninsured, you can save up to 80% on medications, and if you do have insurance, you can receive savings on medications that aren't covered. There are no enrollment fees or special qualifications to get a card other than being a resident of Texas. You can just follow the link on this slide and sign up. GoodRx is another drug discount card that is accepted at many different pharmacies and can provide decent savings for patients without insurance. The third option is patient assistance programs, or PAPs. PAPs are programs that are run by pharmaceutical companies, and they often provide free medications or cover your copays if your income is below a certain threshold. Each program has different rules, but typically you would qualify if your income is less than 200% of the federal poverty level. PAPs are generally provided for the more expensive brand name medications and specialty medications, whereas a drug discount card is more useful for less expensive generic medications. RX Assist is a comprehensive directory of different PAPs that are currently available. And the state of Texas is also developing their own resource for PAPs called Texas Cares RX. It was supposed to be launched in the fall, so hopefully it will be available pretty soon. And they will be partnering with community groups across the state to connect people to PAPs. You can click on the link to learn more. Now that we've gone over the information that I wanted to cover, I'm going to give you a quick quiz on the topics. So first, true or false? Emergency departments can turn you away if you don't have insurance. True or false? You are required to answer honestly when the hospital asks if you are a U.S. citizen. And true or false, the Texas Drug Card provides uninsured residents with up to 80% discounts on prescription medications. The first answer is false. Emergency departments cannot turn you away if you don't have insurance. The second answer is also false. You are not required to answer honestly or answer at all when the hospital asks if you are a U.S. citizen. And the third answer is true. The Texas Drug Card provides uninsured residents of Texas with up to 80% discounts on their prescription medications. Now that we've covered emergency department care and prescription drug coverage, Orphelia is going to discuss how you might be able to benefit from the Affordable Care Act.